All right, we're going to finish up our musculoskeletal course by talking about fractures and some of the common issues you see with these patients. So first, we want to be clear about the difference between a strain, a sprain, and a fracture. A strain is an overstretched muscle, while a sprain is an overstretched ligament. That's really the only difference between the two. Neither one involves any damage to the bone. Now, for strains and sprains, we simply use the RICE method. RICE stands for rest, ice, compression, and elevation. So we want them to rest. We want them to put their leg up if it's their foot. We want to wrap it with an ACE bandage and put ice on it, and that will take care of that. That will heal that over a few days. As far as a fracture, that happens when enough force is applied to the bone to actually crack it or break it. Now, you may or may not see an obvious deformity or bruising around the area, but it's also possible that a fracture could displace enough to put pressure on blood vessels or nerves. So we always want to check circulation and sensation distal to the injury. And then we want to know what happened. We want to ask the patient about the mechanism of injury because that helps us understand what type of fracture to expect. Now let's briefly review the types of fractures. A fracture is either closed or open. If the skin is intact, then it's closed. If it pierces the skin, it's open, also called a compound fracture. Okay. Transverse cuts the bone straight across. Spiral comes from a twisting force. This is actually very common in abuse, where someone will grab someone's arm, that person will try to pull away, and you'll have this twisting force that causes spiral fractures. So this is kind of a classic sign of that. Comminuted fractures is when you have little pieces of bone within the fracture between the two main pieces. This usually comes from some sort of crush injury. An impacted fracture is actually where the two ends of the bone push into each other because of like a vertical impact, like jumping off of a building. Now, green stick fractures is when it doesn't fracture all the way through. And what happens is this happens in children when their bones are still a little bit softer and more flexible. And it's like it bends, but it only splinters on one side and doesn't actually crack all the way through, just like a stick would. And then an oblique fracture is one that is diagonal or vertical or asymmetrical. So oblique fractures are one of the most likely to displace. So you can see how not only has this person's ulna completely dislocated, but they have this oblique fracture of their radius. And so that means that it's no longer aligned, it's displaced, and it can actually cut off blood vessels or nerves in this area. And so it's really, really important that we reset this bone into place and to be in alignment again before we do anything else. So they can do that manually, or they may have to take the patient to surgery to realign it and insert screws to hold it in place. Now, we use plaster casts like this one to help align and mobilize fractures. This allows for proper and straight healing of the bone. I'm sure you or a friend or a family member or somebody you know has had one of these at some point in your life, and I'm sure someone has signed your cast. So I'll go ahead and sign this guy's purple cast. Yay. So when your patients do have a cast, they could have swelling underneath the cast that can cause a lot of problems. So we want to assess for swelling, assess for pain, assess for circulation and sensation distal. So in the case of this gentleman, we want to make sure his toes are pink and warm. We can sometimes feel a pulse in the top of the big toe. So we want to check for that as well. But circulation sensation, we want to make sure he can feel it the same on this side as this side, because if this swelling increases so much, it can actually cut off blood supply. So make sure you're checking that.